Sir, please start, sir.
Good evening, everyone. And in the next series of update,
Please.
Sir, with kind permission of President, sir, I would like to say that today Dr. Sandeep Sharma is not available. He is busy in some meeting. And in his absence, today I am introducing. And in the next series of update on COVID-19, everyone is waiting for what are the updates. This week has been very curious and alarming also, and Dr. Rajiv Jain must have collected all the information which will enlighten us to how to deal further. And I will request Dr. Jain to please, sir, share your experience, sir.
Well, good evening, friends. I welcome you all to this webinar series. And today we are passing through a very crucial phase. All of you are aware that the number of cases COVID very, very high. And not only that, we are facing a lot of crises on front of medicines, on front of oxygen, hospital beds, ICU beds, ventilators, and practically the health system is overburdened with a large number of inflow of patients. So with these few words, I think today's presentation of Dr. Rajiv Kumar Jain is going to be very, very, we are all eagerly waiting to listen to you, Dr. Jain. I will have your delivery.
Thank you all for another session for COVID EPID updates today on a Saturday is relating to the crisis that India is facing, crisis that India has never faced and maybe it will never face in future. But the real challenge lies in actually grappling with this huge challenge that India has and India's leadership has and Indian citizens have. The data is the king, and I believe unless data is understood in its entirety, we would never be able to prepare or manage the pandemic well in India. And if India is not able to manage this pandemic well, I believe the world will not be able to manage the pandemic well. So to begin with, I share my presentation. Is it visible to you? No?
No, sir.
No, okay. Now is it visible to you?
Yes, sir.
Yes, sir.
All right. So,
Sir, please
what I'm
convert
trying
it
to
to a
do
screen in screenshot mode,
at
sir.
the
Means full screen. Yeah. Now it's fine, sir. Thank you.
now is it available as screenshot? All right.
Yes, sir. Now it's fine. Thank you, sir.
So we have discovered the real science of epidemiology, which went into the background all these years. And this science of epidemiology teaches us a lot about the medical science, about healthcare, about how to monitor and what factors will lead to control and prevention of diseases. And the one disease at the moment on everybody's mind and heart is COVID-19 pandemic. If we look at the global situation at the moment through the WHO coronavirus disease COVID-19 dashboard, we should first look at the the 6 regions of World Health Organization, which are Americas, Europe, Southeast Asia, Eastern Mediterranean, Africa, and Western Pacific. These are the 6 regions of World Health Organization. If we look at the total global situation, out of the total cumulative cases of 144 million. 60 million were reported from Americas, 50 million from Europe, and 19 million from Southeast Asia region. And a minor proportion, that is Eastern Mediterranean, 8.7 million, and Africa, 3.2 million, and Western Pacific, 2.3 million approximately, were from these three other regions. The predominantly, the pandemic dominated these three regions of World Health Organization during the past 1 year: Americas, Europe, and Southeast Asia. But if we look at the 24-hour situation, the newly reported cases in the last 24 hours, out of the 894,000 cases that were reported, Southeast Asia region reported 346,000, and Americas reported 230,000, Europe reported 229,000. So the picture is almost same as was in the last 1 year. The only difference is Americas and Europe are receding, and Southeast Asia region is increasing. It is dominant region of the World Health Organization in reporting COVID-19 cases. If you look at the deaths, though the world total is 3.066 million cases, out of which 1.4 million is Americas, 1.0 million is Europe, Southeast Asia is only 249,000, and Eastern Mediterranean is 175,000. That is till date. But if we look at the situation, deaths which were newly reported in the last 24 hours, out of 14,000 deaths reported, 6,500 have been in Americas, 3,758 in Europe, 2,536 in Southeast Asia region, and the other regions have reported 900, 222, and 156 deaths during the last 24 hours. So broadly, the deaths are as per the trend which have been visible in the cases, with Americas dominating, Europe number 2, and Southeast Asia number 3. But this situation is going to change dramatically in the days and months to come. Now we go to the country-wise situation. This is the situation as per the countries. If we look at the total cases reported in last 24 hours, out of 8,94,000 cases, 3,32,000 cases have been reported only by India. And if you look at the difference between the first and second is huge. Brazil is reported 79,000, United States 62,000, Turkey 54,700, France 34,000, Germany 27,000, 25,900. So if we look at the country situation, there is a dramatic shift in one country dominating the entire world, that is India, and the three countries of Brazil, United States, and Turkey are number 2, 3, and 4 in terms of cases reported in the last 24 hours. So you can imagine these 7 countries are the center or epicenters of the world, but the real epicenter lies in India at the moment. If you look at the deaths during the last 24 hours, out of 14,000 deaths, Brazil reported 3,472 and India reported 2,263. No other country reported more than 1,000 deaths. United States 867, Turkey 354, France 283, Germany 265, and Argentina 291. This is the condition of the current 7 countries which are reporting the highest number of cases. So you can imagine the pandemic remains a pandemic because it is not only spread across continents, it is not only spread across subcontinents, it is not only spread across countries, It is spread across regions within the countries. So it is a true pandemic, and it is in evolutionary phase still. We are in the thick of the storm. We are in the eye of the storm at the moment. Now we come to India. If you look at the COVID-19 snapshot in one slide, 3,44,949 cases, new cases were reported. This is the highest new cases reported in 24 hours by any country in the world. And this is India. Last 24 hours, 2,620 deaths, which is the highest number of deaths that India has reported anytime during the last more than 1 year since the pandemic started. 17.5 lakh tests were done yesterday. 7-day average test positivity rate has gone up to 18.5%. 25.4 lakh active cases are there at the moment, and they are growing at 6.2%. So total, we have 16.6 million cases and 1,89,549 deaths till date. Looking at the vaccination, till date, we had 13.84 crore vaccinations, out of which 29 lakh vaccinations were given yesterday. Now we come to the states, and in terms of the 5 parameters, along with the vaccinated persons in percentage, this is the summary of India in terms of states position. On the left is the column where confirmed cases are shown in this column with light blue. Maharashtra is dominating with 66,800, Uttar Pradesh with 36,000, Kerala with 28,000, Karnataka with 27,000, Delhi with 24,000, Chhattisgarh with 17,000, Rajasthan with 15,000, Gujarat with 13,000, Tamil Nadu with 13,000, Madhya Pradesh with 13,000, West Bengal with 12,000, Bihar with 12,000, Haryana is 11,000, Andhra Pradesh 11,700. So these are the states which are reporting more than 10,000 cases during the last 24 hours. So you can imagine how the situation has changed dramatically within a week. There are so many states in India which are reporting more than 10,000 cases, and they are located across the country. They are located in South India, North India, Western India, Eastern India, and all over India. This is the reality of today. If you look at the deaths, as you know, deaths represent the situation 14 days previous to today's situation. So out of 2,600 deaths, 773 have been from Maharashtra. Delhi reported 348, Chhattisgarh 219, Uttar Pradesh 196, Karnataka 190, Gujarat 142, Tamil Nadu 78, Punjab 75, Madhya Pradesh 74, Rajasthan 64, Jharkhand 63, Haryana 60, and West Bengal 59, Bihar 54. So these are the states reporting more than 50 deaths in last 24 hours. So you can imagine the deaths are also spread across the length and breadth of India. They are not restricted to one region. Now, if we have to analyze the situation of confirmed cases and deaths, whether these are the true reflection on the ground, we have to analyze this data, that is tests per million per day. Indian average is 1295.2. Unless this is sufficient, the test positivity rate will not be a true reflection of the true test positivity rate. If we look at the states from the bottom, states like West Bengal is only 534 tests per million they are doing. They are under testing to a huge margin. If you look at Madhya Pradesh, 682 tests per million, Bihar 885 tests per million, Uttar Pradesh 966 tests per million, and Himachal 1400 is high, Jharkhand is 1121, Rajasthan is 1000. So Uttar Pradesh, Odisha, Bihar, Andhra Pradesh, Madhya Pradesh, Meghalaya, Manipur, West Bengal, Tripura, Nagaland, Sikkim are the states which are to increase the test if they really want to understand the spread of infection. Unless they understand the spread of infection, they will never be able to contain the transmission and the disease. Now we look at this figure of 7-day average test positivity rate in terms of percentage. Indian average is 18.5% test positivity rate in the last 7 days. Goa, Delhi, Chhattisgarh, Maharashtra, Madhya Pradesh, Andhra Pradesh, West Bengal, and Haryana are reporting more than 20% tests being positive. More than 20%, 1 in 5. And Chhattisgarh, Delhi, and Goa are reporting 1 in 3, 30, and 34% positive. So you can imagine the situation. And if these states, if you see the figure on the left, whether they are doing correctly the testing numbers, you will understand what I'm trying to say. Madhya Pradesh is reporting 23.8, while Madhya Pradesh is testing 682 tests per million. So there is huge under testing by Madhya Pradesh. So this figure, Madhya Pradesh 223.8, is an underestimate. West Bengal is also reporting 20.8 when it is testing only 534 tests per million. If they test more, they will find more. So these two columns together throw a true light on the way the efforts are being made to detect the individuals and detect the spread of infection. If you look at the 7-day average daily growth in terms of percentage, the Indian average is 1.93. But if you look at the glaring reality, how the daily growth is happening in large states like Uttar Pradesh, Bihar, Jharkhand, Madhya Pradesh, Rajasthan, Delhi, Gujarat, Chhattisgarh, Uttarakhand, Haryana. And these are the states which are showing growth rate which are much, much higher than Indian average. And these are also spread across the regions significantly, which are very, very densely populated, which are poor, and which have very huge compromised status in terms of healthcare infrastructure. So this is the story which will roll out in the day and months to come. If we look at the condition of these states with the growth rate, are they prepared to manage the situation which will roll out in the next 15 days? That is a question which everybody needs to answer today. And one must prepare these states, Uttar Pradesh, Bihar, Jharkhand, Madhya Pradesh, Rajasthan, Delhi, Gujarat, and Chhattisgarh and Uttarakhand to prepare for the future growth of infection and control of infection. If you look at a vaccinated person with at least one dose influenza percentage, India is 8.38%, but look at the bottom. Uttar Pradesh is having only 4%, Bihar is having 4.43%, Assam is having 4.4%, Meghalaya, Tamil Nadu 5.6%, Nagaland 6.16%, Jharkhand 6.68%, Madhya Pradesh 8.2%, West Bengal 8.2%, Andhra Pradesh 8.36%, and Punjab 8.45%. So these are the states which distinctly have huge population, but they have very low number of vaccinated individuals. So what does it mean? It means the vulnerability of these states in the days and months to come is very, very grave. These are states with poor infrastructure, very low capacity of financial governance, and also the ability to manage the manpower resources and the healthcare infrastructure is limited. I shall be discussing two states as examples. One side, I will discuss Uttar Pradesh. I will give you micro data. And on the other side, I will also discuss Kerala. Then you will be able to understand things in a better perspective. These are the 4 graphs where we are showing daily cases, daily active cases, daily deaths, and daily tests on 4 distinct graphs right from 1st January 20 to today. Now, if you look at the graph on the left top, these daily cases, you will agree with me that the first wave was almost a flat line. This is a real growth. These are the real, I will say, the real mountain we are climbing, and we are still climbing. We do not know where the top is. And imagine the pandemic of last year. We were thinking that we have got over, but we were nowhere near control of the pandemic. Daily active cases, if you look at the chart, the way the trend has gone, the situation up till February, March, and suddenly you see the situation turning for the worse. If you look at daily deaths, how deaths peaked sometime in September, October last year, and they seem to be very low because they've never got beyond 1,100. But this time we have already crossed 2,600 per day, and we do not know where it is going to peak, leave aside where it is going to plateau or go down. If you look at the daily tests, we had done daily tests to the extent of 10 lakh cases per day till about, I would say, December end. But then we started going down, and that complacency till March is visible in all the three graphs. And now we are increasing the tests. As I told you, so yesterday we conducted more than 17 lakh tests. But I will show you another graph. What is the number that of tests that is required to be able to understand the situation better? And if you understand situation better, you'll be able to control the situation better. This is the graph which shows you the recovered cases in blue, deaths in red, and active cases in gray. Now, as you know, recovered cases are 83.9% and active cases are 15%, which is also very high. Every 100 pan-India, there are 15 cases out of 100 which are active cases. That means they can spread unless they are isolated. This is the graph showing the black line shows the 7-day moving average and the new confirmed cases in yellow. If you look at the way things have gone up, sometime in September was the previous peak, never gone beyond 1 lakh, but now we are, as you know, we have crossed 340,000 cases a day. So this is the previous graph seemed to be a stunted graph. I do not know whether this graph, how much it is going to go up in the days to come. This is a graph showing average growth rate in active cases in the last 7 days. And it is starting from April 20, it is going up to today. And it shows very little fall for the 5 days in the last 5 days. Now let us see the state-wise position where the fastest growth is occurring in daily cases. In terms of states, we see Delhi is higher than Gujarat, higher than Kerala, higher than Maharashtra, higher than Chhattisgarh, higher than Karnataka, higher than Uttarakhand, and higher than Haryana, higher than Himachal Pradesh, and then all India. And there are several union territories which are showing very high. If you look at the graphs, you will understand it is not isolated upsurge. It is very widespread across the length and breadth of India. The Indian graph is here, and the Himachal, Haryana, Pondicherry, Dadra Nagar Haveli, Karnataka, Uttarakhand, Chhattisgarh, Maharashtra, Chhattisgarh, Chandigarh, Kerala, Delhi, Goa, this is Lakshadweep, and this is. Now, Mumbai and Pune are taking a breather while the other metros are racing very fast. If you look at, this is Pune, you will see there is a kind of plateau, and Mumbai, there is a little fall in the recent week. Bangalore is going up, Delhi is going steeply up, Chennai is going steeply up, and Kolkata, West Bengal is going very steeply up. And they will continue to grow very strongly up. Now look at the daily testing, which is rising sharply overall at the national level. It is crossed 15 lakh, now it is 17 lakh tests per day, and that is a good sign, but this is not sufficient. Daily growth of tests has been much lower than that of daily cases for the past 1 month. The average test
Dr. Rajiv, you are not audible.
I was on this slide. Is the slide visible?
Now slide is visible and now your voice has also come back. Please
All
proceed.
right. Is it all right now? So I was saying that we need to test more. If we test more, then only we can know where the infection is. Only then we can control and isolate and quarantine individuals. Otherwise, we will be facing with a situation which will shock us more than we think. In this graph, growth of cases in the blue and growth of tests is in red. If you look at the plateau, the way tests are, they're not increasing. The way test positivity rate is increasing and the growth of cases. Test positivity rate is in green and blue is growth of cases. And you look at the red. So the conclusion is we need to increase the testing. Now, if you look into the situation in Delhi, it's very, very difficult to get the test done. Number one, most of the laboratories are saying we will not do any home collection. Number two, even if you submit the test at the testing site, they say results will be available not before 4 to 5 days. So 4 to 5 days, the person who is given the test is not aware what is the result of the test. That's second. Number three, the locations where the testing is occurring are not convenient to individuals. People who are residing in areas where there is high test positivity are not able to access the testing sites. So daily tests are rising everywhere in the country except in Delhi where it is falling sharply. Yesterday, we had seen around 79,000, 70,000 cases. Tests were done. And earlier, they exceed 110,000 as well. Big delays and rising nervousness is there in Delhi and still very difficult to get tests done in Delhi. That's a major area of concern. If you look at the graph, it is going down. All of the states is going, Maharashtra is going up, Kerala has gone up, Karnataka, Tamil Nadu, Uttar Pradesh is still, Andhra Pradesh, all the graphs that are showing that it's gone up. Few of the states have not gone up the way they should have. Haryana is an area of concern and Assam is area of concern, Jharkhand. These are the states which require to ramp up their testing. Odisha is an area of concern. Now we come to an important state that is Uttar Pradesh. And this will be the eye of the storm in the days and months to come. This shall be the state which shall face the real brunt of COVID-19, as I will show you in the graphs and this graph and the subsequent graphs. If you look at the new cases, which is red, and the test positivity rate, which is blue, test per million per day is in yellow at the bottom, you will understand what I'm trying to say. Daily COVID-19 cases, deaths and test positivity rate are skyrocketing. Uttar Pradesh presently contributes 11% of all active cases in India. Delhi's testing is stable at 2.515 lakh per past 1 week, despite sharp increase in cases, which is much less than India's average test per million. Only 4% got at least one dose of the vaccine, the second lowest in India. So the two areas of concern are testing not being ramped up and a very low number of percentage of population having received at least one dose of vaccination. So unless these two areas are addressed, there shall be no way that the growth of cases could be controlled. And the cases are not controlled, deaths will not be controlled. Now we'll go into the deep areas of that is districts of Uttar Pradesh. This is daily new cases and 7-day moving average in districts of Uttar Pradesh during this week. This is Lucknow, Prayagraj, Kanpur Nagar, Varanasi, Ghaziabad, Gautam Budh Nagar, Meerut, Gorakhpur, Bareilly, Jhansi, Muradabad, Agra, Muzaffarnagar, Saharanpur, Aligarh, Balia, Barabanki, Lakhimpur Kheri, Jaunpur, Ayodhya, Mathura, and Raebareli. So what you see, all these districts are having more than 10,000 cases, and Prayagraj is having 56,000 cases, Kanpur is having 51,000 cases, Varanasi is having more than 50,000 cases. Even Ghaziabad, like 32,000, and Lucknow is the epicenter, 1,62,000 cases. So you can imagine what is going to happen in a district like Gorakhpur, 31,000 cases, Meerut is having 31,000, Bareilly 21,000, Jhansi 18,000. All these districts are having more than 10,000 cases, and they are spread across the geography of Uttar Pradesh. So the infection is widespread in Uttar Pradesh at the moment, and it is growing very, very fast. And the tests are not being done the way they should have been ramped up. And also vaccinated population is very small, only 4 out of 100. 96 have not received even one dose of vaccination. This is another graph, which is other districts of UP, which are showing less than 10,000, but more than 5,000. And look at the districts. They shall shortly be above 10,000. All these districts will shortly above. And look at the names: Ghazipur, Devriya, Azamgarh, Bulandshahr, Shahjahanpur, Sultanpur, Sonbhadra, Chandauli, Hardoi, Etawah, Pratapgarh, Unnao, Gonda, Sitapur, Kushinagar, Basti, Rampur, Mirzapur, Maharajganj, Lalitpur, Bijnor, Farrukhabad, Amroha, Bahraich, Banda, Badaयूं, Auraiya, Jalon, Hapur, Siddharthnagar, Firozabad, Amethi, Shamli, and Kannauj. So these are the districts which are showing more than 5,000 cases, which are confirmed cases, which are diagnosed cases, tested cases, and they are growing fast. So you can imagine the situation in Uttar Pradesh. Another graph I will show you next, which is related to new deaths in districts of Uttar Pradesh. Now, this is interesting. Despite the sharp rise in cases, a corresponding spike in deaths is yet to be seen. Usually, a 2-week delay for spikes in deaths is expected. However, it's been more than 3 weeks since Uttar Pradesh started experiencing increased daily cases. So, what do we conclude? So, underreporting of deaths may be suspected. If you look at the graphs, none of the districts which are showing more than 50,000 cases have shown a spike in deaths, which should have been visible by now. None of the districts relating to deaths during the last 7 days is showing a spike increase in deaths. Now we go to the other districts which are showing more than 5,000 to 10,000 cases. Again, in none of the districts you see a spike in deaths. So the conclusion, underreporting of deaths needs to be, I think the reasonable hypothesis is there is underreporting of deaths in Uttar Pradesh. Now we come to Kerala. Kerala, daily new COVID-19 cases have seen a 10-fold increase in the past month, and 7-day test positivity rate has gone up to 18%, which is 5-fold increase. It contributes to 7% of total active cases in India, but leads among larger states with 16% of population being jabbed with at least a single dose of vaccine. If you look at the test per million, is at the bottom in yellow. New cases is in red, and test positivity rates is in blue. This is reported daily new deaths in gray bar diagram, and mortality rate is in red, which is little bit gone down below 0.4%. This is daily COVID-19 deaths and mortality rates in Kerala. New deaths have been suspiciously low and not commensurate with the trends in cases as expected. So there is something, some data is missing somewhere. Now, Kerala, if you look at the district-wise position, the second wave has well surpassed the first in every district of Kerala, with Ernakulam leading all the way. This is Ernakulam. Total cases 1,64,000, highest in Kerala in any district, and at the moment it is rising, touching to 5,000 new cases. Kozhikode touching 3,000, Malappuram touching 2,500, Thiruvananthapuram touching 2,000, Thrissur touching 2,000. All these have got more than 1 lakh cases. Kottayam has got 1 lakh cases. Kollam has got 1 lakh cases. Alappuzha 93,000, Kannur 77,000, Palakkad 73,000, Pathanamthitta 68,000, Kasargod 41,000, Idukki 37,000, and Wayanad 34,000 cases, and they are growing. If you look at the spike of cases, new cases reported, you can understand what I'm trying to say. None of the districts we are seeing any stability or any plateau being reached. This is the daily vaccination. They continue to show a fluctuating trend. If you look at this part of the graph, as total vaccination crossed 135 million, 13.5 crore individuals have received the vaccinations. Now, if you look at the locations with the hotspots, we will understand what is the situation. Over the past week, Delhi has been under the spotlight for the manner in which its people and healthcare infrastructure have been overwhelmed by the spread of COVID-19. The national capital had to fall back on a lockdown once again as a containment strategy. Data on reported COVID-19 deaths from 7 other states suggests they could be hurtling towards similar crises that will stretch their health systems and likely lead to stricter lockdowns in the coming days. There are 27 states where the number of COVID-19 deaths has increased for the 2 weeks running. 7 of them recorded a week-on-week increase in the number of deaths greater than Delhi in the past week. Delhi's week-on-week increase in reported deaths was 6.1%. Among these 7 states, the week-on-week increase was led by Chhattisgarh, which is 17%, Jharkhand, which is 16%, and Gujarat, which is 10%. The other 4 states where death rates have spiked are Madhya Pradesh, Himachal Pradesh, Rajasthan, and Bihar. At a weekly growth rate of 17%, a state will see weekly deaths double in about 4 weeks, at 9% in 8 weeks. So you can imagine what I'm trying to say. Like Maharashtra and Delhi, Chhattisgarh is another example of how rapidly the virus can multiply and send disease numbers and the health care and economic situation spiraling out of control. Last week, Chhattisgarh reported the highest weekly increase in confirmed cases and deaths among all states. 2 weeks ago, it registered only 299 weekly deaths. Last week, it reported 967 weekly deaths, accounting for 10% of all India deaths, the third most amongst all states. If you look at the chart on the right, you will understand what I'm trying to say. Chhattisgarh, Uttar Pradesh, and Gujarat, they form 25% of all reported deaths in the last 1 week in the country. This shows the growing spread. As the deaths curve steepens across states, new infections continue to rise. With 340,000 new cases of COVID-19 in India on Friday, India set a new record by reporting the biggest daily increase in any country ever. Given that testing is trailing demand and is happening with a lag in several states, this number 2 is probably an undercount of the total caseload. Worse is the virus seems to be spreading faster across the country than in the first wave. There were 317 districts, or 44% of all districts, that reported More than 1,000 new cases in the past 7 days. States with a large number of such caseload districts are Maharashtra, Kerala, Chhattisgarh, and Uttar Pradesh. There are 70 districts, 70, across 16 states, where the number of new weekly cases exceed 5,000 in the past week. A month ago, the number of such districts was just 9, all in Maharashtra. Now they are across. Now we look at the vaccine slowdown. The growing spread of the virus is in turn increasing the demand for oxygen and hospital beds across the country. The ongoing crisis has led to a sharp shift in India's vaccination policy, with the center allowing state governments to strike their own deals with vaccine companies. However, this will be easier said than done, given the prior commitments of vaccine manufacturers and the steep price they are now quoting. At the moment, India's vaccination is flagging. In the first week of April, when vaccines were made available to all above 45 years, India averaged 3.6 million vaccine doses per day. This fell to 2.6 million doses over the past week amid supply constraints. Among key Asian economies, India and the Philippines have faced the brunt of the second wave, leading in new mobility restrictions in both the countries. However, while the Philippines has been able to raise its vaccination rate, India is still struggling. If you look at the position of 100 weekly change in COVID-19 vaccine doses per 100 people is percentage, Philippines 24%, Japan 21%, Mexico 17%, Bangladesh 12%, China 11%, India only 11%. Russia 10.6, the United States 9.5, Indonesia 8, and Brazil 6.6. And this is the cumulative COVID-19 vaccination. United States 63.8%, and Brazil 15.9%, and China 13.6%, Mexico 11.1%, India is 9.2%, Russia is 11.4%. This is another graph which shows unequal coverage. While India ranks third in absolute number of doses globally, its large population means low vaccination population coverage. Among the 10 most populous nations for which vaccine data was available, India was ranked 6th on the cumulative doses per capita, according to data portal, Our World in Data. In this grouping, only the US has managed a high coverage of its population. Among major states, Kerala, Chhattisgarh, and Gujarat lead on vaccines per capita. Maharashtra, which remains the epicenter of the current wave, lags far behind these states. Some of the other high caseload states such as Bihar, Uttar Pradesh, Madhya Pradesh, and Jharkhand lag even behind Maharashtra in vaccine coverage. For India, the surge in cases is a harsh reality, while health infrastructure struggles to keep up and vaccines take time in ramp up. More and more state governments are opting to impose lockdowns of different intensities to avoid descending into a situation like Delhi or Maharashtra. So that is the situation on the ground. If you look at this graph, the less than 92% are in light gray, dark gray color. Light gray color is 92 to 136.9, and these are 136.9 to 213, and more than 213 is only at the top over these three areas. Tamil Nadu is having 64, Tripura is having 226. This is in terms of coverage, vaccine coverage. So this brings me to the end of the presentation, but the major issue I wanted to flag was the situation is grim, but not that grim, which is going to happen in the days and weeks to come till maybe middle of May. This will be the toughest challenge that India is going to face in the next 1 month. What has happened in Maharashtra and what is happening in Delhi is nothing in compared to what is going to happen in Uttar Pradesh, Bihar, West Bengal, Madhya Pradesh, and Assam. So India needs to prepare well for a very grave situation in areas which are thickly populated, which are poor, and which have very challenged healthcare infrastructure. So that will be my take for today's epidemiological situation on COVID-19 in India. Thank you so much for giving me an opportunity to share with you all the situation of COVID-19 in India and across the world. Thank you. I will be happy to take up any question that may arise in audience mind.
First of all, I congratulate you for giving such a detailed analysis of the prevailing situation. And with that, even you could forecast where we are leading, going to be. Now, there are 2-3 questions which are arising into my mind after going through your presentation. Your total emphasis is only on the testing. But now the difficulty is even the testing doesn't reflect test. There may be a number of false negative cases. Even RT-PCR, it is taking very, very long time. And by the time the report comes, the patient is either recovered or passed away. So I think with the situation where the health infrastructure is so much under strain, is it wise to be totally focused on testing? Number one. Number two, best strategy so that we can ramp up our vaccination. I think instead of focusing on testing, now the time has come when in the market there are 6-7 vaccines are available. Those are internationally approved. We must focus on the rapid vaccination of the population. So what are your views on these two comments?
I cannot disagree with what you're saying. The challenge is the vaccine production and import of vaccine. The challenge is that all the manufacturers of the global at the global level, they have prior commitments. They have received the payments and they have to fulfill those commitments. So they're not ready to export to India. The companies which are manufacturing in India, there is bigger challenge. They've also made commitment for contribution to Covaxin, Covax, that the platform which WHO has. India is facing the pressure from WHO to contribute to that pool where vaccine go for in the global pool for global administration of vaccines, like ramping of vaccination in Africa, which are much poorer than India. The companies which are still manufacturing, they have to meet the government of India commitments, also meet the states and the private sector demand that is going to come up. So the demand and supply imbalance almost dictate that rapid scaling up is not possible at the moment. As you know, government of India has already committed, and from 28 April, the registration on COVID application will start. But you will see the way things are organized, it will be a gradual scaling up, and supply chain have to be in place. That will take time. That will take time. For though it may start from 1st May, but the real demand and supply gap shall remain. Both the producing companies, Serum Institute as well as Bharat Biotech, are scaling up. Bharat Biotech will take up sometime in June. They are saying they will be able to scale up, and Serum Institute has its own constraints. The issue is the pricing. Also, people are commenting that earlier they had sold at 150. Why they are selling at 600 rupees? The reply that the SASI today has given, that there is no other way they could ramp up their production capacity unless they get the money. Only government money will not suffice to scale up the production. So there are big challenges in terms of scaling up production. We do not have that much capacity, and there are prior commitments. Even Serum Institute of India has huge pressure globally to meet those commitments, which are, they've received the payments and they've committed to that pool. And you must remember, Serum Institute of India vaccine is not 100% Indian vaccine. The investment has been made by other companies and other countries as well for development. So these are the constraints. One has to work in a real constraint situation. That's why I made it a point. And the people have been saying ramp up vaccination in areas which are going to face the brunt of infection. So match, earlier people were saying, no, vaccination should be focused on Maharashtra and Gujarat, where the highest scale of infection has been there. So that challenge will remain. Uttar Pradesh, Bihar, Madhya Pradesh, West Bengal, Assam, Odisha will change. With Jharkhand will face the real challenge in the months to come.
Thank you.
Let's see how it rolls out. I'm hopeful things will be managed, but all the models that have predicted by like Institute of Health Metrics and Evaluation, which is the global center for health measuring health, they have predicted 5,500 deaths by the middle of May per day, and new cases reported to be around 5.5 lakh.
My God.
With the current situation or current rate of testing and the infrastructure, they keep on collecting the data, and the prediction in the past 1 year has been almost true. You go to the IHME website, you will see the model, and it's a dynamic model. You can see even states, you can see even the country, you can see even the continent in a visual form, and you will understand what is being predicted by the best experts in the world.
Thank you, Dr. Saab. Dr. Chaudhary, there are some questions.
Yes, sir. Even I have one question, sir.
Please take up.
Sir, the questions to Dr. Jain, sir, that the predictions that you have made out that it may go up to 5.5 lakhs and the death can be 5,000, more than 5,000. So if we see the rate, the way it is going, so by which week you expect the peak? If we go by the same data. And second, recent this crisis of oxygen supplies to the hospitals, which is causing a lot of panic in the patients and everywhere, and how it will be managed, and up to what time it will be normalized according to you?
Well, the Institute of Health Metrics and Evaluation has had models being created for a very long time, even before COVID-19, and the entire global burden of disease and dialysis and entire investment. They are the think tank which predict. And the current model that is available is predicting that peak to be reaching by the end of May. And the deaths will start peaking around end of May, and cases will start peaking around middle of May. That is the prediction, and all trends that are visible, as I showed you, like deliberately I showed you smaller districts of Uttar Pradesh. Showed you middle districts and larger district of Uttar Pradesh. If you look at the population density of these districts, deliberately I had chosen Uttar Pradesh as an example, because of you will understand what the challenges that Uttar Pradesh faces on the ground. Eastern Uttar Pradesh has different challenges, Western Uttar Pradesh different challenges, and currently if you go to Lucknow, you will understand what I've said. The current situation in Lucknow is grim. The situation is going to get worse in the other districts. And if you visit Uttar Pradesh, there are very few large hospitals with functional intensive care units available in Uttar Pradesh. It is not like Maharashtra. It is not like Kerala. It is very different. The population density is hugely different from that we have in Kerala and Maharashtra. Educational level is different. Per capita income is different. Administrative structure is different. So the model is based on these realities. And this is also, please remember, this is also taking into account the underreporting of deaths, underreporting of cases due to low testing being done. So this figure is not my figure. It is through a scientific modeling method, and the current trends. If they reverse, I would be more than happy. Every one of India would be happier. But the current trends are quite visible. As I showed you through different graphs, not only state graph, the district graphs, and the cities graphs were visible to you, and you can see the population that is there. And the transmission and the confounding factor, you must remember, is the variants. The triple variant has come, double mutant variant was already there, and I showed you last week how the dominant strain is the double variant. today in India. B.1 was a major variant earlier. Now it has been B.1.617. So these two variants together are confounding the whole picture, and they are spreading faster. The second question that you had was regarding oxygen. I feel the way out of this situation is rationalization. And as you see, AIMS and ICMR yesterday brought out a revised treatment guidelines, which has been highlighted in newspapers all across the country. People in the medical profession and people other than medical profession have to understand what is rational and what is not rational, and where do you require oxygen and where non-oxygen measures like proning, and also measures where you need to monitor and use room air or air in the environment more effectively for longer period shall help immensely. Another worrying feature which I have found in Delhi, I was talking to the doctors in tertiary care hospitals, especially large corporate hospitals. Their concern is people are not willing to get discharged now these days. They're not willing to leave the bed. So that is another panic on the other side. The clinicians want the patient to be discharged and managed at home, but the patient and patient relatives are not willing to leave the bed. So that is another challenge which clinicians are facing across big hospitals in Delhi. So these are the ways in which, and you must have seen how Ministry of Health, AIMS Director, ICMR DG were time and again were advocating proper use of room air and proning as a method to enhance available oxygen usage in the lungs, and external oxygen being not the solution till SpO2 goes below 90% or 89%, so to say. So I believe more rational treatment adherence on the ground shall help a lot, rather than only focusing on oxygen. Like earlier, you remember, there was a huge demand for plasma. Then there is a whole demand for tocilizumab. Then there is a wave for remdesivir. Then there is a wave for steroids. Then people could understand where exactly you need to use dexamethasone and what amount, at what stage of the disease, and for what duration, and what dosage, and what route. These are all important areas which need to be understood by all the people on the ground. And you understand, all cannot be expert in all the fields. So that is another challenge. So what government is trying to do is to communicate fast, so that people, practitioners across specialities understand the rational application of resources. Resource will always be under constraints. The resource will never be perfect in a country like India. When resources were not perfect in US, leave aside in India.
Right.
But the good thing is, we are not dependent on ventilators today. Everybody is talking about non-ventilator based strategies. That is another good thing that we've learned from USA.
So there are a few questions from the participants. One question is, a second wave in India involving children and adults spreading exponentially is because of which dominant mutant strain?
Well, this is a hypothesis which is not borne out by data. As a Niti Aayog member, Dr. V.K. Paul had shown through the data collected by ICMR, and it is true data. First wave and second wave, there is not much difference in the incidence of COVID-19 if you have the age-wise distribution of cases. So it appears, but there is no exponential increase in young adults and young children, even neonates.
And there are two questions from Dr. Lele. One is vaccination of pregnant women and lactating mothers.
Yes, that is important. If you look at the WHO guidelines, which is a living guidelines, on 21st of this month, they've revised and they've recommended pregnant lactating women can take Covishield.
And another question is mathematical model. So the pandemic will start receding in mid-May. What is your opinion?
I would request everybody who is attending to go to the Institute of Health Metrics and Evaluation website, IHME website, and see the model for India, and see the model for Asia, and see the global model. And you will see in a very dynamic and impressive way how the things are going to roll out in the days and months to come. And you can see in terms of cases, you can see in terms of deaths also. It's very visible and very educative to go to this Institute of Health Metrics and Evaluation website. So peak, they are, as I told you, deaths may peak around end of May and cases may peak around middle of May. That is the current prediction. It keeps on changing every day based on the real data. The current, if you look at the website now, you will see this in very graphical terms because it's a dynamic visual model.
This is the last question, which the Covaxin is indigenously made, therefore has no WHO commitments. Could that be a way out?
It is not so. In the global situation, India has made commitment. There is a Covaxin is a vaccine, but there is a COVAX platform in the World Health Organization where India has made a commitment, and other countries have also made commitment. India is a major partner, so it is wrong to say that Covaxin is only. It is not. It is a global resource, and it's a pandemic. We tend to be very nationalistic, or like states were very specific about their state pool of oxygen. Vaccine is a global resource. Some of the countries which are using it for their nation are living in a fool's paradise. It's a pandemic we are talking. Everybody will get affected. Everybody is getting affected. Everybody will continue to get affected. You cannot live in today's world as a country or a state or a continent. It's not possible. So we will continue both the strategies. We will keep on contributing the global pool, and we will continue to scale up production in India for our own people. And that's why in the months to come, you will see a huge increase in capacity. The challenge would be people coming forward to take up the vaccine. As you have seen, Sputnik 5, initially it will be imported, and then Dr. Reddy's will be manufacturing. There are 7 other companies which will be manufacturing. There are 10 other companies which have developed their capacity to manufacture vaccines. And the other companies are also willing to give a vaccine at a very, no profit, no loss, as Pfizer was saying. J&J is also saying. So let's see how that rolls out. But one cannot predict.
Yeah.
I see in the chat also there was some what.
Yes,
Okay.
I have put up that. There's one
Right.
question. Yeah.
So anybody else who want to?
Yeah, somebody
ask
raised a
anyone?
hand. Yes.
Yeah,
Anyone,
yeah.
your
Good
hand is
evening. Yeah, good evening, Dr. Rajiv. As usual, it's a very educated talk. We are all educated. I've got I need two clarifications from you. One, nowadays, when rapid antigen test is positive, I don't know for what reason they are doing RT-PCR, and RT-PCR is turning out negative. Could you please explain that, number one? Number two, you have shown us UP model, and where the number of fresh cases is very high, but the number of deaths are less. So you say that it is underreporting. But I mean, in my understanding, it is the new variants have got high morbidity but less mortality. So am I right in my thinking?
Well, the reality is there are two issues that you raised. One is rapid antigen test and RT-PCR.
Yeah.
Well, if you look at the graph and what rapid antigen test does and what RT-PCR does, in the initial phase, when the infectivity or the viral load in the nasopharynx is very, very high, rapid antigen test shall be positive. But if you do it the same in the same person RT-PCR test, it may be negative. that can happen. It is not related to the virus structure or the spike protein or any antigen within the virus. We take a sample and sample detects. If rapid antigen test is positive, nothing else to be done. Rather, it is the other way around. If it is negative, the person is symptomatic, and
Yes.
rapid antigen test is negative, then person has to go for RT-PCR.
Yes.
That is the protocol. If people do not remember the protocol, then there'll be a problem.
Yeah.
It is not a validation test of rapid antigen test. It is not designed that way. So it should not be used that way. Now we come to Uttar Pradesh. Well, countrywide, we have seen the mortality at the rate of 1.4% today. Now, 1.4 is a figure which has been going down to 1.18 over the past 1 year. How does that fall has occurred? It is not due to genetic variation. It is due to better management on the ground. If early reporting happens due to early testing, early hospitalization, early isolation, early relationship between the home isolation and hospitalization, likelihood of deaths is much reduced. Now in Uttar Pradesh, the data I had shown, normally in all over the country, all the data that has been available, whenever the spike has occurred, 14 days later, the death spike has occurred. But that is not visible in Uttar Pradesh. I showed you the data. So
Yeah.
that is why the problem may be due to multiple factors. The person dies, but he's never tested for RT-PCR with RT-PCR or rapid antigen test because the testing facility is not available. The deaths are occurring, but they're not recorded as COVID deaths. The deaths may be due to COVID, right? So this is the reason precisely that testing has to be scaled up. Uttar Pradesh is doing very low testing per million population. It is at the bottom. I showed you the graph on TPM. Uttar Pradesh and Bihar were lying at the bottom. So Uttar Pradesh and Bihar need to scale up testing, and not only scale up testing in Lucknow, they have to scale up testing in eastern Uttar Pradesh districts. They have to scale up testing in south Uttar Pradesh districts like Jhansi and around Lalitpur. These are the districts. If you know the landscape, I've visited all the districts of Uttar Pradesh as part of a research project. And I've seen how much the landscape changes from one district to the other. Just go out of Lucknow, how much underdevelopment is there? If you go go out of Varanasi, go out of Prayagraj, within 50 kilometers, you will see the huge underdevelopment. Even in Sultanpur, Raebareli, if you actually see the things on the ground, then one can understand the challenge to testing, healthcare, and reporting of deaths. These are three major issues, which are real issues.
Thank you.
Dr. SP, if there are no questions, then we can.
Yes,
wind
sir.
up.
Thank you, Jain sir. Always giving new data and showing us the way this epidemic is going. And at present, you are right that the day the peak number will come, and it will be starting of the good time also, because after any peak, there has to be a plateau and there has to be end. So with that positive note, I'll request our president, sir, to please, sir.
Okay, thank you all. Thank you, Dr. Rajiv, and thank you all the participants. It was a real lot of information out of this.